Well, it's a huge privilege to stand up in front of you all again in the 50th year, the 50th anniversary of the modern hospice movement. And it's been a phenomenal year, again, for hospices and for Hospice UK. At Hospice UK, I'm so proud that we merged this year with the National Council for Palliative Care, that we've been running 86 fantastic projects this year, that we've done so well with our finances. And just to announce as well that even more collaboration's happening, and the team from the Gold Standards Framework are moving into Hospice House even as we speak. So welcome to Kerry and the team. Now, as you know, Hospice UK is all of us, and it's about the story of hospices. And I have to say, I sat down a week ago and started thinking about the different reports and the things that I wanted to highlight today. And I was a little bit nervous, because I couldn't help but wonder what was going to happen with hospice finances this year. What was I going to see in our accounts report? Were we going to see the first downturn for 5 years? No, we didn't. I was actually quite surprised. I know that fundraising is really difficult, and I know that last year we saw that 2/3 of hospices said that their CCGs had either frozen or cut their funding last year. But when we looked at hospice finances, we saw that hospices last year together turned over a phenomenal £1.4 billion. Now, over £1 billion of that came in fundraising, which is absolutely incredible and shows the support that the public have for their local hospice. And when we looked at CCG funding, it is pretty much holding up. Now, we've got wide variations, but we're still seeing that average, sticking for adult hospices around 32% and children's hospices around 15%. Now, if you want to know more, please do go to the Hayes McIntyre stand. We're so grateful to them for sponsoring the Hospice Accounts Report and putting it together with us, and you'll find a lot of information and breakdowns showing you the trends. One of the things that we've also done this year is that we've looked at a sustainability matrix for hospices. And we've looked at 5 key measures of financial sustainability. Many of you will know about this, and you'll have called up Hospice UK and you'll have spoken to Craig Duncan about where you sit and what you might want to think about in terms of your long-term sustainability and the questions that your board might want to ask. I know that up to half of hospices have already called up and spoken to us about this, but if it's something that you would find valuable, then please do pick up the phone and speak to us. We'd be delighted to talk you through that. Now, looking at what hospices have achieved last year, and we know our income's gone up a little bit, but the amount of work that hospices have done out in the community is phenomenal. Now, you know me, and last year I stood here and I said, we need data and we need to be able to tell our story. And we started doing that last year, and this is the first year we've got a comparison. We are not stopping here. We need to do more, and we're going to be asking you to fill out more surveys and give us more information and work with us to get a better data set. And that work will be continuing thanks to kind support by the Peter Selby Foundation. But what I can stand here and tell you today is that hospices last year helped an amazing 212,000 people. And I can also tell you that there's been a huge increase in hospice at home. 179,000 of those people were helped at home. And that takes the inpatient total to just 16% of people that were helped in a hospice inpatient unit. Now, we know that we need to get that story out there, and we need to tell people that hospice care happens in the community. And it really does. It was over 20% last year. So we can see that shift really happening. The other thing that I want to pull out from the hospice account, the hospice in the UK report, and you can find it on the Hospice UK stand, so please do go and take a look afterwards if you haven't already. I want to pull out the fact that hospices worked with 46,000 people last year to deliver bereavement support. And it's the first time we've gone out and tried to tell that story. And I wanted to compare that. So I went to look at the top 3 bereavement charities in the UK. So I looked at Cruise, CB UK and Winston's Wish. And I looked at their annual reports and added together the number of people that they helped across the UK last year. And it was 37,000. We've got a huge story to tell with bereavement support, and it's relatively new for hospices. I know that Help the Hospices As Was, we gave out grants 15 years ago, and that's when a lot of hospices started running this service. But I think that there's more that we can do to work together to share knowledge. There's some really phenomenal pilots and projects going on out there, helping children in schools, helping families, pre-bereavement support, working with volunteers. It's amazing what's happening. But I also want to reflect on the need out there. And that's one of the reasons that we had the plenary speech last night talking about bereavement support. Because even if we add up those two figures, if we set that up against the 600,000 people that died last year and how many people were affected by all of those deaths, we're not even scratching the surface. So there's a huge amount more that we need to do. We've got a grants program out at the moment. We're working with the Advisory Council to put together a new stream of work around bereavement support. And I'm really excited about that for the future. Now, even with all this, you will see in the hospice report that there's 118,000 people last year who could have really benefited from our help who we didn't get to. And we mustn't stop until we're able to reach all of those people. And of course, we heard from Professor Irene Higginson yesterday that that number is only going to grow and become more complex. It's one of the reasons I'm so proud that we signed off last year for the first time a 5-year strategy of the hospice movement together. And it is by working together that we're going to be able to achieve this. And interestingly, one of the first things we said is that we cannot do this alone. It's not just about hospices, it's about acute hospitals, it's about GPs, it's about community pharmacies, it's about communities, it's about sheltered accommodation and care homes. It's all together. And that's one of the reasons that I'm so proud that we merged with National Council for Palliative Care this year. Because what that says to everybody is death and dying is everybody's business. And if we want to help all of those people, we need to reclaim death and dying as part of society. And we all need to become so much more comfortable with it. I'm really pleased that Dying Matters is now an integral part of this conference. And many of you will have gone along to the session this morning, and you'll be ramping up and thinking about what you're doing next May. It's going to be an absolutely key part of what we do. You'll have all seen as well that we've got lots of displays and posters around for Project Echo, and we've got a stand near the Hospice UK stand. I think it's one of the most exciting projects that we've signed up to. Now, if any of you doesn't know about Project Echo, and I've been talking about this really for the past year, it's an initiative that started out in New Mexico, and it's a way of getting specialist knowledge and a few specialists to be able to pass on their knowledge to people in communities to be able to help more people. And it worked really well with things like diabetes and substance abuse, and it's working fantastically well for end of life. It first came over to the UK through Northern Ireland Hospice in Ireland, and they did a phenomenal job at rolling this out. And I'm really pleased that what we're going to be able to do at Hospice UK is enable hospices to become the hubs of their communities and the hubs of education. We talk about democratizing knowledge, and it's about getting more people not just skilled up, but it's also a mentoring approach so that people build more confidence. If you think about a hospice that might be working with 10 care homes, rather than having a nurse drive out to each care home and do your MDT discussions, and we look at the prognostic indicators and would we be surprised if somebody would die in the next week or month or year, and putting those plans together one-on-one, which is expensive and it takes time. Imagine if all of those care homes were on a Project Echo, and all it takes is a screen, and it looks a bit like Skype, but the underlying solution is called Zoom. It's very low bandwidth. You can use it on an iPad or a phone. It will work over 3G. It will get past NHS firewalls. But it's a way of facilitating discussions, bringing in not only the experts to be able to advise on anonymized case studies, but also to be able to bring in other people who are learning, who may have seen that case happen last week or last month. So Alison from Care Home A, you had this a couple of months ago. What did you do? And as Alison talks and her peers are nodding and people say, well, you did a great job, Alison's got so much more confidence. And the next time it happens, she's so much less likely to pick up the phone and call for an ambulance and send that person into A&E. Because they want to be in the care home, they've got dementia, they feel much more safe where they are, they want to have a good death with their family around them in the care home. And we can help and support that by working together. Now, before the conference, we had 90 hospices signed up, which was phenomenal for Project Echo. I'm pretty convinced we'll leave this conference with many, many more hospices signed up. Now, of course, it's all about working together and working together across sectors. And one of the projects that we started this year was sponsored by NHS England and working with McKinsey Consultancy. And you'll hear more about this tomorrow if you go along to the session at 10 o'clock with Jonathan Ellis. And it's our holistic project. And we're working with 24 hospices and multiple different ways of working with the acute sector to either avoid unnecessary admissions to hospital or get people out of hospital at the end of life when they don't need to be there. And we're looking at how effective those projects are and also how cost-effective they are so that we can commission off the back of it. And Michael will remember that we met with Simon Stevens last year and we did look him in the eye and we said, if we do this, are you going to come back to us and say, we need more data? And Michael, didn't he say to us, no, when we have that, we will commission off the back of it. He looked us in the eye and he said that. So I'm really excited that we'll be able to go out with that data next year. We'll be able to prove the case for hospice care, and hopefully we'll be able to go out and get bigger and better contracts with CCGs off the back of it. And the numbers are staggering. I spoke to Jonathan and got some of the most recent numbers. And the NHS is currently spending 12% of its annual budget on end of life. The cost of the admissions bit alone, so not keeping people in hospital, but just the admissions bit, is £1.3 billion a year. And as we know, that's practically the cost of running the entire hospice movement. So I know that we can create more value, we can get people out of hospital, we can get people to where they want to be. But of course, some people will want to be in hospital at the end of life, or they will need to be in hospital at the end of life, and we mustn't forget those people. We need to work together as a sector. So I'm really excited that we're continuing the project with our friends Macmillan that we inherited through the NCPC merger, and it's going really, really well. Working with 10 acute hospitals, going round and looking at what they can do better with that objective eye, looking at things from a patient's perspective, looking at how we can change and work together. And we're also continuing our work with the emergency departments as well, looking at what it feels like for people when they've had that horrible shock to be called in to find that somebody, one of their loved ones, is suddenly dying or has died. What it feels like to walk to the morgue, what it feels like when they're looking after the body, what kinds of services they need, what signposting do they need, make sure that they're not forgotten. That's one of the projects that we're working on, and I'm really, really pleased that we're doing that and we're working together and signposting through to the hospices as well. Now, we also said that there are lots of conditions, different conditions we want to work with and different people we want to work with, and they feel unrepresented by hospice care and palliative care in general. Now, as many of you know, I had a personal reason for wanting to do more with heart failure this year because my gran died of heart failure and I couldn't, despite my position, I couldn't get her any palliative care and I couldn't get her out of hospital to a hospice. So I'm so delighted that this year we put out a guide for how hospices can work with the acute sector to identify those people with heart failure, work with them earlier, work in partnership, and help them and support their needs towards the end of life. And in the same way we're doing now with our projects, we want to make our projects multi-year and we want to build on them. So we released a grant fund this year, thanks to St James's Place, of £500,000, and we're working with multiple hospices to put some of these ideas into practice. We'll be echoing and we'll be getting those people to share their information. We'll be pulling together their best practice. We'll be pushing that out in due course into training courses and conferences and make sure that we get this out so it's a standard part of delivering hospice care. And we're working with many other conditions to be able to do that. I'm also very conscious that there are groups of people that we're not necessarily giving the best possible service to as well. And one of those, and many hospices have spoken to me about this, is around transitions. So we're going to be doing a lot more work in partnership with Together for Short Lives, in partnership with hospices and housing associations and education teams and employment services and local authorities to look at what that group needs and to be able to support those transitions task forces across the UK. Just because somebody has reached the age of 18, it doesn't mean that they're the same as anybody else who's reached 18 with a life-limiting condition. They often haven't expected to live that long. Their families haven't expected them to live that long. Suddenly, the services that they've been depending on have ended. They used to be in school, so the parents were actually used to being able to go out to work and socialise, and now that young person comes back home. And they've got vastly different developmental and emotional ages. And we're treating them as though they're one group, and to a certain extent we're forgetting them. They don't sit easily with an adult hospice because they're not necessarily at the end of life. So we need to look at how we're going to work with and support those people, and also pull together the data to find out who they are, where they are, how many of them there are, and how this is going to change over the next 10 years so that we can plan for this and work together to support that important group of people. Now, one of the other things that we learned 18 months ago from a CQC report was that there are a lot of people out there who feel discriminated against at end of life. And they don't feel that palliative care is for them or would work for them, or even that they would be welcome. And that includes many people in the LGBT community, some of the faith groups, the homeless, travellers, and people in prisons. And we know that hospices are doing a huge amount of work with these groups. And we were really pleased this year to get a Department for Health grant to be able to pull together some of that best practice. I also want to mention our Open Up campaign at this point as well, because while we're talking about this 118,000 people who are not accessing hospice care, not all of them are unable to access it because we don't have the funds to help them. Sometimes they don't feel that it's for them, and that's why they're not coming to us. Now, I was really, really pleased this year when we came together and ran this campaign for the first time, and we started to challenge some of those notions. And hospices put out many stories of how they had helped different groups of people. And I remember one particular case study from a Northwest hospice where they had a married couple, two gentlemen, and they told their story, and then they told how they'd held hands when one of them died in the hospice. And it had a phenomenal reaction because people hadn't realised that hospices are not just white and middle class for heterosexual couples. They actually do reach out and look after everybody. And it created a phenomenal debate. And we need to do more of that because we need to make sure that everybody understands that hospice care and palliative care is there for them. And everybody, no matter who they are or where they are, deserves the very best end of life possible. Now that brings me on to communities and carers. And that community support and taking out palliative care is absolutely essential because we will not be able to deliver these services without having resilient communities and taking death back into communities and talking more. I'm really pleased that this year we have managed to secure a new grant with the Big Lottery Fund, a new portfolio, and we're working with 5 community organisations who are telling us and working with the hospices to develop the services they want rather than the other way around. We're also doing an awful lot of work thinking about carers as well. And this is not just about carers as a group of people that we need to support and look after, but it's also thinking about carers as co-deliverers of hospice care and end-of-life care. What skills do they need? Do they know how to lift somebody safely? Do they know how to take someone to the toilet with dignity or make a bed with somebody in it? I don't. If somebody didn't show me, I wouldn't know how to do it. And yet we almost expect it to happen. So it's thinking about how we can use the resources that we already have and work together with communities and volunteers to be able to upskill those people because they really want to give the very best end-of-life care to their loved ones. Now, many of you will know that we did a bit of an unusual campaign this year. And the Department for Work and Pensions certainly thought it was unusual, that we went out and said, we need to think about carers' leave. And we need to work with employers, and we need to make sure that people understand about flexible working, that it's not just for women with childcare responsibilities. It can be used for people for all sorts of reasons, and for men as well. And employers need to make sure that they are looking fairly at any request for flexible working. But we're also conscious that with this sandwich generation that we've got at the moment, with parents who are living hundreds of miles away, who have complex conditions, who used to be very independent, maybe living in homes that they can't maintain anymore, gardens that they can't maintain anymore, not near public transport, that they need looking after. And at the same time, people are holding down jobs, mortgages, their children may be still at home or economically independent, or they've got grandchildren they want to spend time with, and people are hugely stretched. And what's going to happen is people in their 50s and 60s, predominantly women, are going to end up giving up their jobs because they need to look after somebody at the end of life, and they're not going to be able to get back into employment, certainly not at the same level they were at before. So one of the questions that we asked was, well, why can't we have parity with maternity leave? I mean, after all, these are often the same women who had to fight for their rights in the 70s and 80s. Why can't we help them now? So we went to the Department for Work and Pensions and we spoke to the minister. And the minister said, well, it absolutely works for me. I need to keep people in work until they're 67. We need people to be staying on until they get their pensions. But we left the meeting and some of the civil servants ran down the corridor after us and said, well, why Hospice UK leading on this? Why is it not one of the carers' charities? And we said, well, the carers' charities are absolutely behind this, but we can't deliver hospice care without carers. They are our partners. We're looking at the future of hospice care, and this is absolutely crucial for us to be able to deliver that. So I'm really pleased that we're able to go out in the next few weeks, and we're running some roundtables with the Department for Work and Pensions, and they're very keen to kick off some projects and get some pilots out there and start looking at this. But we also want to drive it through the employers as well. And that's why I'm really proud of our corporate supporters, because they've been asking the questions about how they can become carer-friendly organisations. And we've asked them, do you have lists of carers? Do carers feel that they can come forward and be supported? Or are they worried they might be seen to have different priorities and not be fully on board with their jobs? And we've been working together to put together some of these policies. And one of the big projects that we're working on over the next year is the Compassionate Workplace project, which was started by National Council for Palliative Care. We're working with that, and we're looking to be able to take that out to more and more workplaces. And this is another way that we'll be able to get end of life out to more and more communities and make it much more of something that people are accepting of and understand their responsibility and able to reach out and help people. It all comes together. Now, the final strand of our strategy, of course, is to empower a sustainable and dynamic and innovative hospice sector and end-of-life sector. And a huge amount of the work that we've been doing, a huge amount of the 86 projects that we've had on over the last year have been around that. So whether that's around governance or training or support, the Peering Over the Precipice programme that many of you will have heard about, looking at hospice finances, sharing best practice, all of that is going towards making sure that hospices are fit for the future and the end-of-life sector can grow and help more people. Now, I often stand here and I say Hospice UK is about all of us, and it's about all of us working together, and it is. But I also want to take this opportunity to thank the 63 fantastic employees that we have at Hospice House, because without them, we couldn't make this possible. And I have no idea, even as Chief Exec, how we're managing to do all of these projects and all of this support. So can I just pause and ask, Hospice UK employees, can we stand up and give you a round of applause, please? Stand up, stand up. Thank you very much. We are so incredibly proud of you all. But I want to finish by saying how proud I am of all of you. We know there's more to do, and that's why we're all here, but we are making a difference. You are making a difference every single day. 212,000 families last year had a much better experience at the end of life because of you. You only get one chance with these families, and you all took it. You go the extra mile, nothing is too much trouble. You solve problems, you make things happen, you turn things around for families. You are all phenomenal. I want to end by saying thank you very much.